Hello, I'm Larry Brown, the Medical Director for the Department of State. Being the Department's Chief Medical Officer is a joy and a challenge for me. And as a family doctor, I see the need to give you as much useful information as I can about influenza, and especially about the possibility of a pandemic flu. That's the emphasis of this program. The Department's Office of Medical Services is preparing for an influenza pandemic by pre-positioning medication and personal protective equipment like gowns and masks at all overseas posts. But that's only part of our preparation. The other part is to educate you in what you can do to protect and treat yourself and your family during any influenza outbreak, whether it is avian influenza or the common seasonal flu. That's what this program will do. It contains useful information that you will need to know during an outbreak. It will also instruct you on a practical approach to caring for yourself or for family members should they become ill. Watch this program through once and then put it in a safe place so you can refer to it again as needed. If you have any additional questions, contact your healthcare professional. By preparing and learning now, you will be ready to act at the first sign of an influenza pandemic. I hope you find this information interesting and useful. Thank you.
Be prepared is a motto that some of us learned long ago as children, but it can serve as a reminder to protect ourselves and those we love from infectious diseases. This video will help you understand a little about pandemic influenza and actions you can take to keep you and your family in good health. An influenza or flu pandemic is a widespread outbreak of disease that occurs when a new flu virus appears that people have not been exposed to before. Pandemics are different from seasonal outbreaks of influenza. Outbreaks of seasonal flu are caused by viruses that many people have been exposed to. Flu shots are available to help prevent widespread illnesses. Pandemic flu spreads easily from person to person and can cause serious illness because people do not have immunity to the new virus, and the resulting impact on society may be more severe. A pandemic may come and go in waves, each of which can last for months at a time. Everyday life could be disrupted due to millions of people and communities around the world becoming ill at the same time. These disruptions could include everything from school and business closings to interruption of basic services such as public transportation and health care. An especially severe influenza pandemic could lead to high levels of illness, death, social disruption, and economic loss. Pandemics have happened before with deadly results, and some scientists feel that we are due for a pandemic again. In many parts of the world, wild and domestic birds are currently experiencing their own influenza pandemic, transmitting the virus from bird to bird. Some humans have caught this virus directly from sick birds. We fear that this avian flu virus might mutate or cross over and spread from person to become the next human pandemic flu virus. For these reasons, we'd like to take a few minutes to tell you what may be useful should an influenza pandemic become a reality. Avoiding infection is the best way to ride out a pandemic of influenza. After basic hygiene methods, especially good hand washing and keeping a distance from people sick with influenza, immunization is usually the best way to avoid catching any type of flu. That is why getting immunized each year against the seasonal flu is a good idea. However, because we do not know exactly which flu virus may cause a pandemic, we have no specific vaccine to prevent a mass outbreak at this time. Influenza vaccines are designed to protect against specific flu viruses. As of May 2006, There was no human pandemic flu in the world, but the federal government was making vaccines for several existing bird flu viruses that might provide some protection should one of the bird flu viruses change and cause a human flu pandemic. A specific pandemic influenza vaccine cannot be produced until a pandemic flu virus strain emerges and is identified. Once a pandemic influenza virus has been identified, it will likely take 4 to 6 months to develop, test, and begin producing a vaccine. Fortunately, there are other ways to avoid catching the flu. In the prevention segment of this presentation, you'll learn how to prevent flu infection by keeping a distance from sources of influenza virus. In the traveling germs section, you'll learn how germs are spread and how to reduce your chances of becoming infected. Being aware of how you might become infected will help you avoid contamination. Washing your hands and keeping a distance from those who are ill are two of the most effective methods to control infection. In the hand washing segment, we will cover the best techniques to clean your hands, either with soap and water or by using hand sanitizing agents. The infection control segment will cover social distancing, interacting with sick people, and how to clean your surroundings after a potential exposure. Despite the best precautions, however, infections still happen. If you come down with flu-like symptoms and influenza exists widely in your area, chances are you too have the virus. We'll tell you what to do if you get sick and how to care for family members who are ill in the home health care and treatment sections. You will learn how to minimize the risk of catching an infection while caring for a family member or neighbor and how to manage fever, chills, and cough, which are symptoms of the flu. We will also cover the use of prescription and over-the-counter medications. The goal is to get your family members through any infection and back to normal without spreading the virus to others. Exposed family members may be asked to stay at home so they do not contaminate friends or coworkers. This self-imposed quarantine could last days or even weeks. The planning segment will tell you how to plan for emergency situations and what staples to have on hand should supplies and transportation be limited in your community. In general, at least a month's supply of food, water, essential medications, and emergency supplies are recommended. The use of personal protective equipment is not routinely recommended except for healthcare workers or in other special circumstances. Nonetheless, in an effort to prepare for unexpected situations, the personal protective equipment section will show how masks, gowns, goggles, and gloves are effectively and safely used, and how to decide which items may be appropriate to use. Lastly, we give you a summary of good health habits that will go a long way in helping you avoid many contagious illnesses, not just the flu. These reminders of basic hygiene and other courteous behaviors can be among the most important defenses against the common cold as well as influenza. Now please feel free to watch the other sections to learn how to avoid contracting pandemic flu and how to respond to an infection if it occurs. Be sure to look at any brochures your medical professional gives you about pandemic flu and emergency planning. They have useful checklists and other reminders. Like the flu shot, being prepared only hurts a little. This section provides useful information to help you prevent the spread of infection. Avian influenza, H5N1, or the bird flu, is a disease of wild and domesticated birds caused by influenza viruses. Bird flu viruses do not usually infect humans, but since 1997, a number of confirmed cases of human infection from bird flu viruses have occurred. Most of these resulted from direct or close contact with infected birds, such as domesticated chickens, ducks, and turkeys. The spread of bird flu from one infected person to another is extremely rare and has not been reported to continue beyond one person. A worldwide pandemic could occur if a bird flu virus were to change so that it could easily be passed from person to person. Experts around the world are watching for changes in bird flu viruses that could lead to a pandemic influenza. People in areas of the world that have bird flu outbreaks should avoid contact with poultry and should stay away from the live poultry markets where birds and people come into close contact. People who raise chickens, pigeons, ducks, or geese should wash hands after having contact with any birds and avoid all contact with infected birds. Well-cooked poultry or poultry products pose no health hazards as long as proper food hygiene practices are followed. There is no need to be worried about poultry consumption, just contact with sick birds in regions where the virus has emerged. To safely prepare poultry, wash your hands before and after handling food. Keep raw poultry and its juices away from other foods. Keep hands, utensils, and surfaces such as cutting boards clean. Use a meat thermometer to ensure poultry has been fully cooked. The internal temperature should reach 180 degrees. If the avian flu virus evolves and a pandemic occurs, then passing germs from person to person will become the primary method of transmission. If pandemic flu reaches your community, hand washing and social distancing measures such as staying home when you are ill and keeping a safe distance from those who are ill will be important to decrease the spread of influenza. If pandemic influenza reaches the area where you live, do not come to work or go to social events if you have any of the following symptoms: fever, cough, runny nose, vomiting, sore throat, diarrhea, abdominal pain, muscle aches, or shortness of breath. These are all symptoms of influenza. If you become sick at work, go home and call your healthcare professional. Do not return to work until you have recovered. Cover your mouth and nose when you cough or sneeze. Use your upper sleeve and elbow, not your hand, if tissues are not available. Avoid close contact with people who are sick. Try to keep a distance of at least 3 feet between you and someone with a respiratory illness. Limiting your exposure decreases your chances of becoming sick. Avoid touching your eyes, nose, and mouth. This reduces the chance of infecting yourself with viral particles or other germs on your hands. When you are sick, keep your distance from others to prevent them from getting sick too. Teach your children to stay away as much as possible from others who may be ill. Practice good infection control, especially washing your hands often. Maintain a healthy lifestyle. Exercise, rest, and eat a balanced diet to help strengthen the body's ability to fight infection. Avoid smoking and secondhand smoke. So to summarize, in areas where bird flu is present, avoid contact with birds, especially sick ones. Handle and cook all poultry safely. If pandemic flu is in your area, stay at home if you are ill. Avoid contact with sick people. Try to keep at least 3 feet between you and someone who is ill with flu. Maintain healthy lifestyle habits and wash your hands often. The flu usually spreads from person to person in respiratory droplets or spray when people who are infected cough or sneeze. Maintaining safe personal distance is vital. You can become sick by being in the direct line of someone's cough or sneeze. During a cough or sneeze, infective droplets generally travel no more than 3 feet or 1 meter. These droplets may transmit infection if they are inhaled or come into contact with mucous membranes of your eyes, nose, or mouth. Infection is also easily spread by direct or indirect contact, such as touching an ill person or surface contaminated with virus, and then touching your eyes, nose, or mouth, allowing these infectious droplets to enter your body. Influenza germs from the droplets can persist much longer than you might think, even 2 to 3 days on a smooth steel surface such as a doorknob, and less time on a more porous surface such as a used tissue. Shaking a hand or handling a contaminated item such as a toy, door handle, or food may be all it takes to transmit germs from one person to another. Imagine how many hands touch the door handle, ATM machine, or shopping cart you use. There is little evidence that transmission of influenza can occur across long distances, such as through ventilation systems or after prolonged suspension in the air. How much airborne transmission may contribute to the spread of influenza is uncertain. The exact method of how the virus causing a pandemic spreads won't be known until a pandemic occurs. Nonetheless, we know that preventing contact and droplet transmission is very important to prevent the spread of the flu. People with the most severe flu symptoms are most likely to pass infection to others. However, healthy adults without symptoms may be able to infect others one day before they become visibly ill, and for up to 5 days after they become sick. Therefore, it is possible to give someone the flu before you know you are infected, as well as after you've started coughing and sneezing. So to summarize, the influenza virus can spread by respiratory droplets as well as by direct and indirect contact. Practicing good infection control techniques, such as frequent hand washing and keeping a distance from those who are ill, is always a good idea. While it may seem very basic, knowledge of proper hand washing techniques is crucial. Judy will demonstrate the single most effective way to stop the spread of infection: cleaning her hands after a potential contact with germs. Washing with soap and water or an alcohol-based hand sanitizing product is the #1 way to stop the transmission of germs. Using soap and water is the best method if facilities are available. Before washing, inspect your hands for any open cuts or scrapes. These openings can be a way for germs to enter your body. Wet your hands with warm, running water. Leave the water running. Apply enough soap to make a good lather. You can use antibacterial soaps, but they are not really necessary. Normal hand soap will do. Rub your hands with palms together, creating friction. Then wash the back of your left hand with your right palm and interlace your fingers. Repeat this action with your other hand. Then move to the thumb, rubbing and rotating the opposing palm around the thumb with a good circular rub. And move on to the wrist. Move your rings up your finger. Soap where they rested, then slide them back down again. Don't forget to wash under your fingernails. This process should take at least 15 seconds, or the time it takes for you to sing one verse of Twinkle, Twinkle, Little Star. Rinse well under warm water, and rewash if needed to remove any remaining soil. Pat your hands dry on paper towels, then use those paper towels to turn off the faucet and open the door. Try not to touch anything directly with your clean hands. No soap and water? Let's see how Judy cleans her hands when she has only alcohol-based hand sanitizer available. Any visible soil should be removed first with a wet wipe. Judy then dispenses the sanitizer into dry hands and begins to rub all surfaces as she would do if washing with soap and water. The big difference is that this should continue until your hands are dry in order for the product to protect you adequately. You should not rinse your hands. When should you wash your hands? Anytime you think you might transmit infection to yourself or others, especially after coughing or sneezing. After contact with sick persons, their effects, or their environment. After using the bathroom or toilet. After using public transportation. Before eating or preparing food. Before leaving your workplace. To review, rub your hands with palms together, creating friction. Then wash the back of your hands, interlacing your fingers in the same position. Then move to your thumbs, rubbing and rotating. Then your wrists. Slide your rings up your finger, soap where they rested, then slide them back down again. Don't forget under your fingernails. We recommend that you practice these procedures now before you are confronted by coworkers, friends, or family members who are sick. These are simple steps to follow. The more you practice, the more efficient you'll be in protecting yourself from germs around you. The following scenario is one that takes place every day around the world, interacting with people who may be sick. Barbara has learned about personal infection control measures. She knows coughing and sneezing spread influenza, and infectious droplets may remain on a surface for a prolonged period of time. Arriving at work, Barbara prepares the area for the upcoming day, cleaning exposed surfaces.
Pete, you don't sound very good. Are you ill?
Yeah, I woke up this morning with a slight fever and a cough, and it just seems to be getting worse. I took a ibuprofen, but it doesn't seem to be doing much.
Oh, I had a cold last week, and it was miserable. Here, take a tissue.
Barbara is sharing how to control coughing and sneezing when you're ill. You should cover your mouth and nose when you cough or sneeze. If you don't have a tissue, cough or sneeze into your sleeve rather than your hand to reduce the spread of germs. Individuals with flu symptoms should stay home so they do not infect others.
It's the policy of the office that if you're really sick, stay home.
Maybe I should go home. I'll go talk to the boss.
Individuals should also make sure to follow good cough etiquette when they cough or sneeze. If they must move outside the home, they should wear a mask to decrease the spread of infectious droplets.
My name is Pete Wood, and I got sent home from work this morning with a cough, and I'm feverish, and I've got chills, and I'm short of breath, and I think I need to see a doctor immediately. I need to see Dr. Jones.
Okay, and your name is?
Wood, Pete Wood.
Since Pete isn't at home and is exhibiting flu symptoms, he should wear a mask. The mask will decrease the spread of infectious droplets. He should not touch commonly used objects that may also spread disease. A mask limits outgoing infective droplets when worn by a person with flu symptoms. A healthy person may limit incoming infective droplets by wearing a protective mask. Wearing a protective mask may be important for persons who are at high risk for complications of influenza. Everyone, but especially these people, should try to avoid public gatherings such as movie theaters, restaurants, and social activities when pandemic influenza is in their community. They should also avoid going to other public areas such as grocery or drugstores, using others for shopping or home delivery services if possible. So to review, in a public environment, you should avoid contact with people who are visibly ill and try to keep at least 3 feet from someone who is coughing or sneezing. Clean your work area so your hands don't inadvertently come into contact with hidden germs. Wash your hands often, taking care not to infect yourself by inadvertently touching your hands to your mouth, nose, or eyes. Avoid touching commonly used items that may spread the disease. If you are ill, stay home so you don't spread the disease. Wear a mask if you are around others. Cover your mouth and nose when you cough or sneeze. Try not to touch objects that others may use. Wash your hands often. These are important measures to help maintain a healthy environment for all individuals. What would you do if one of your family members were to become ill with influenza and had to be cared for at home? Keeping an ill family member at home will minimize the spread of the virus in your community. There are many ways to minimize the further spread of the virus within your own household. This segment will give you ideas to prevent the spread of illness while providing good supportive care to your sick family member. A sick family member should be isolated from others as much as possible. Therefore, consider having a single caregiver for your patient, preferably someone who is not at high risk for complications of influenza. If possible, try to provide your patient with a separate room. A separate bathroom is also important if this can be managed. A surgical or procedure mask worn by the patient and/or caregiver may be of benefit to decrease the spread of infection from the patient and to protect the caregiver. A medical care provider from outside your home that must visit the patient will probably wear personal protective equipment, including a mask, gloves, and gown, as demonstrated here by a visiting nurse. Patients should not leave the home during the time when they are most likely to be infectious to others. When movement outside the home is necessary for medical care, patients should follow proper cough etiquette, covering nose and mouth when sneezing or coughing, and wear a mask. You, the caregiver, should minimize close, prolonged contact with the individual, and wash your hands immediately and thoroughly each time you leave the sick room. Any eating utensils used by the patient should be handled as little as possible and washed in hot soapy water or in a dishwasher. Wash your hands thoroughly after handling any contaminated personal items. When changing or carrying used linens, towels, and clothing, be sure to carry the items away from your face and body. You may further minimize contact with contaminated linens by immediately putting them in a bag or clean pillowcase to carry to the washing machine. If you are caring for a small child or a very disabled family member who is having difficulty breathing, who is unable to wear a mask or control secretions, personal protective equipment such as mask, gown, goggles, or gloves may be necessary but are not routinely recommended. Check with your healthcare professional to see what may be appropriate in your circumstances. Ideally, one bathroom should be designated solely for use by the patient. If that is not possible, after the patient uses the bathroom, all surfaces should be decontaminated with a disinfectant spray or diluted solution of bleach and water. 3/4 cup of bleach in 1 gallon of water makes an effective disinfectant and should be left wet for several minutes before wiping dry. If you are the home health care provider for your sick family member, you will need to provide routine care until the patient is no longer infectious as determined by your health care professional. This may be up to 14 days. You may need to learn some home health care tasks that are unfamiliar to you. We will review a number of these care measures. We encourage you to discuss any questions you have with your health care professional now, before any pandemic occurs, and throughout the patient's recovery process. Basic home care measures to help with recovery from influenza include rest, good hydration, control of fever, and control of pain and discomfort. While the patient will need and want lots of rest each day, encourage your patient to get up and out of bed several times each day while staying in the bedroom. Some physical movement reduces the risk of further complications like pneumonia or bronchitis. Encourage your patient to drink plenty of fluids every day. Rehydration solutions like Gatorade or Pedialyte may be useful to prevent dehydration if vomiting or diarrhea is significant. A patient should drink enough to make the urine pale yellow or almost clear, which is an excellent sign of good hydration. Encourage the patient to drink small amounts of fluid frequently throughout the day. Your healthcare professional may want to know how much liquid the patient has consumed each day, so if requested, keep a tally sheet. While there are no specific dietary restrictions for patients with influenza, the patient's appetite will likely be reduced. Therefore, small, easily digestible meals should be offered frequently. The brat diet, bananas, rice, applesauce, toast, is easy to digest, but let the patient eat whatever and whenever he likes. Just as important as monitoring fluid intake will be monitoring the patient's temperature and medicines. You may measure the temperature in degrees, Fahrenheit, or Celsius, whichever your thermometer uses. Just be sure to stick with the same system of measurement throughout the illness. This is how you take a temperature orally with a thermometer. If you take the temperature orally, wait at least 15 minutes after the sick person has had anything to eat or drink, so that the resultant temperature is not changed by a hot or cold food or drink. You may also take an axillary or under-the-arm temperature, but it is less accurate. There are also thermometers that measure temperature through the ear, which are also quite accurate, and the newer disposable thermometers are also accurate. Whichever kind of thermometer you use the same one each time and measure the temperature the same way. Unless you have special instructions, measuring temperature twice daily is sufficient. Here is a chart of normal and abnormal temperatures in both Fahrenheit and Celsius. You may be asked to keep a log sheet on the patient's temperature. Here is one example. It will also be important to record the dosages of medication and the times they are taken. Medications such as acetaminophen and paracetamol, also known as Tylenol and Panadol respectively, are used commonly to treat fever and muscle aches associated with flu. Aspirin can also be used, but never give aspirin to children or teenagers with flu-like symptoms. It may cause serious complications. One important healthcare measure is to encourage the patient to breathe deeply, cough, and move about the room at least every 2 hours when awake. To do this, encourage the patient to breathe slowly and as deeply as possible to fully expand the lungs and then exhale slowly. Have the patient do this 3 times. During the 3rd deep breath, before exhalation, ask the patient to cough. The patient should cover the mouth and nose with a tissue while coughing, and the caregiver should stand outside the room or well away and behind the patient. These measures will improve the patient's respiratory health and help prevent complications such as pneumonia. You will be the eyes and ears of the healthcare professionals during this period of home recovery for your ill family member. You will also be your loved one's support person in many physical and emotional ways. Be sure to ask lots of questions of your healthcare professional and encourage your family member to do the same. Earlier, we outlined some of the symptoms and signs that you will encounter while caring for someone with the flu. Be careful to watch these signs closely as they may indicate patient improvement or a developing complication. Bacterial infection following a viral infection may occur, so monitor the patient carefully and keep your healthcare professional informed of changes. If your patient exhibits any of the following symptoms, contact your healthcare professional immediately. Severe or prolonged flu symptoms that last more than 10 days. Difficult, rapid, or painful breathing. Bluish skin. Dizziness or fainting. The return of cough after symptoms have improved. Dehydration, the feeling of dry mouth or excessive thirst. Confusion, or worsening of an existing serious medical condition like heart or lung disease, diabetes, or cancer. Should you develop influenza, there are a variety of ways to treat the symptoms such as cough and fever, and some new medicines are being developed to combat the actual virus. In spite of all efforts at prevention, viruses spread and people become ill with colds and flu. What should you do? First, it may be useful to determine if a viral illness is a common cold or the flu. Most flu is easily recognized by these typical signs and symptoms that are usually much worse than a bad cold. We don't know what typical pandemic flu will look like, but we expect it will probably have symptoms that are similar but more severe than seasonal flu. Here is a chart that shows some common differences between a typical cold and flu. However, if there is any doubt about the nature of your illness, contact your healthcare professional to seek advice. While the flu can be very unpleasant for anyone, it can be particularly trying for people who have chronic illnesses such as diabetes, heart disease, or asthma. Flu can also be harder on the very young and the elderly, so these individuals may require more attention and your healthcare professional should be consulted. Flu symptoms may not be so typical at certain ages. For example, infants with the flu may only exhibit fever or poor appetite. Young children may have vomiting, abdominal pain, or diarrhea, and the elderly may not experience any fever at all. The treatment approach for most cases of the flu and other viral infections is what we call symptomatic. That is to say, taking measures that are designed to minimize the unpleasant symptoms while the immune system fights the infection. These symptomatic measures include over-the-counter medications such as acetaminophen, throat lozenges, and cough syrups. Healing measures include bed rest, adequate hydration, and extra sleep. Be prepared to rest in bed, miss some work or school, and postpone any sports, exercise, or training programs until you have fully recovered. It is important to give your body time to recover. Even after you are well, depending upon the conditions in your area, you may be asked to remain at home a few more days so that there will be no further spread of the virus. In recent years, certain antiviral medications have been developed that, if taken early in the course of influenza, may shorten the duration of the illness by a day or two. Some of them may even prevent a full-fledged bout of the flu. We hope that antiviral drugs such as Tamiflu or Influenza will be useful or perhaps even life-saving for combating pandemic influenza. To date, we really don't know how useful certain antiviral drugs might be. Your healthcare professional will be the best source for the most up-to-date guidance. Common flu symptoms may include fever, chills, cough, muscle aches, and perhaps nausea, vomiting, and diarrhea. Pandemic flu is expected to be similar but more severe than seasonal flu. Very old and very young people may have different initial symptoms of the flu. Home-based symptomatic treatment with lots of rest and fluids will be helpful. So to summarize, newer antiviral medications may be useful in combating pandemic or severe flu. Consult your healthcare professional as needed. Most people recover from the flu with no long-term problems, and we expect the same outcomes should we experience a pandemic flu. However, even if a small percentage of flu patients get seriously ill or die during a pandemic, there would be a tremendous burden on our healthcare system. Personnel or facilities may not be able to treat the great number of infected people. Therefore, now is the time for you to consider how best to prepare to care for yourself and your family in a pandemic. Each of us must take the precautions mentioned earlier to prevent the spread of pandemic influenza and to treat the illness as best we can in the home setting. Responding to a disaster or emergency health situation is easier if you have planned and are prepared. Your specific plan should consider the location in which you live and the personal needs of you and your family. If you have any questions about how to develop an emergency plan, talk with your medical professional. Visit the websites of Health and Human Services at www.pandemicflu.gov and the Centers for Disease Control at www.cdc.gov for more information. For a pandemic flu outbreak, storage of at least a month's supply of food and water is recommended, although the pandemic may go on for several months. It is also a good idea to have a method to purify water. During a pandemic, if you cannot get to a store, or if stores are out of essential goods, having extra supplies on hand will be very important. These supplies also can be useful in other types of emergencies, such as power outages or natural disasters. Stock up on other essentials too, like laundry soap, paper towels, facial and toilet tissue, and disinfectants such as bleach. A stockpile of non-perishable foods which are useful to have on hand may include ready-to-eat canned meats, fruits, vegetables, soups, protein or fruit bars, dry cereal or granola, peanut butter or nuts, dried fruit, crackers, juices, bottled water. Include baby food and formula if you have an infant or toddler. And don't forget extra pet food. Ask your healthcare professional and insurance company if you can get an extra supply of your regular prescription medications in case the supply chain slows. In addition to prescription medications, remember to keep prescribed medical supplies such as glucometers and syringes. Stockpile non-prescription drugs and other health supplies that you may need, including medicines for fever and pain relief such as acetaminophen, paracetamol, aspirin, ibuprofen, cough and cold medicines, stomach remedies, antidiarrheal medication, vitamins, and a thermometer. Make sure to have rehydration fluids containing sugars and salts such as Pedialyte or Gatorade. Also keep a supply of disinfectant, soap, or alcohol-based hand sanitizer. Make sure to have a first aid kit available. Although no studies have assessed the use of masks or other personal protective equipment at home to decrease the spread of disease, Use of masks by the patient and/or caregiver during interactions may be beneficial. Therefore, maintaining a stock of masks may be useful. You may consider buying other personal protective equipment such as goggles, gowns, and gloves. Surgical or procedure masks or respirators may be purchased at drugstores or hardware stores. If you stock these items, make sure that you know how to safely use them before you need them. Consider having general emergency supplies and equipment on hand for an extended stay at home. These might include a flashlight, batteries, portable radio, manual can opener, garbage bags, tissues, toilet paper, and duct tape. Develop a system of communication for contacting family and check in periodically. Figure out how you will communicate with your supervisor or colleagues if you have to stay at home. Talk with family members about how they would be cared for if they got sick or what would be needed to care for them. Put together an emergency contact form. Get involved. Volunteer with local or community groups to prepare for and assist with emergency response. Planning for a disaster or an emergency is an important measure you can take to protect yourself and your family. Again, review the list of non-perishable items you and your family will need. Be sure to include food, water, medical supplies, as well as general emergency supplies and methods of communication in your emergency preparedness kit. Review the plan with your family and organize supplies so they can be easily accessed by all family members. Advanced planning can be the key to staying healthy during an outbreak of an infectious disease. The very best infection control methods are distancing yourself from a sick person and washing your hands often and well. The use of personal protective equipment, or PPE, as might typically be worn in certain medical settings, is not recommended for home use. However, there may be occasions when putting additional barriers between you and infectious germs may be appropriate or would help you feel more comfortable. These may include times where you expect to have direct sustained personal contact with or exposure to a flu-infected patient, especially someone who is unable to control secretions or wear a mask, such as an infant or elderly person with breathing problems. This may also occur if you act as a healthcare provider for a person outside your home or if you are asked to perform medically related duties as a medical responder. Consult with your medical professional about any of these special circumstances before you use PPE. PPE may reduce but does not completely eliminate the possibility of infection. PPE is only effective if it is used correctly at all times when contact may occur. PPE never replaces basic hygiene measures. This information about personal protective equipment is presented not because we expect you to need or use PPE, but rather so that you have a reference and are able to use these barrier protections properly should the need arise. Here are some items considered personal protective equipment in the medical setting. They include a mask or respirator, protective gown, gloves, and goggles or a face shield. In periods of increased respiratory infection in the community, persons who are coughing or sick with influenza should wear a mask to contain respiratory secretions. Although the use of masks in community settings has not been demonstrated to be effective as a public health measure, a person may choose to wear a mask as part of individual protection strategies that include good cough etiquette, hand hygiene, and avoiding public gatherings. In some areas of the world, wearing a mask when in crowded public areas is recommended as a method to possibly decrease the spread of disease. Masks come in all sorts of materials, shapes, and sizes for all sorts of functions, and they are often given more specific names depending upon their use and composition. The most common varieties are the N95 particulate respirator and the surgical or procedural masks. Surgical or procedural masks are designed to help prevent the wearer from spreading germs to others. and may also prevent some germs from infecting the wearer. The N95 respirator is designed to protect the wearer from incoming infective droplets or airborne transmission of a disease. Some N95 masks may have small one-way valves on the front of the mask to allow for easier transmission of air out of the mask. It's very important not to use this valved respirator on anyone who may be sick and coughing, because coughing while wearing this model may actually concentrate and project infectious droplets further. It does not prevent the spread of droplets. A gown helps keep infectious material from contaminating your clothing. When selecting a gown, be sure to have an appropriate type and size for the task. For example, a water-resistant gown may be important if there is a chance you could get wet with bodily fluids. Although we don't know exactly what sorts of precautions the next pandemic influenza may require to slow the spread of disease, nothing indicates that clothing would be a significant vehicle for spreading the virus. Gloves protect your hands from infectious materials. As we learned, the best methods of infection control are washing your hands often and not touching the mucous membranes of your eyes, nose, or mouth, whether your hands are gloved or not. Goggles or face shields protect your eyes from splashes or spray and should not be needed in most situations for infection control of pandemic flu. The types of personal protective equipment appropriate to use depends on the level of precautions required. Talk to your healthcare professional about what is appropriate in your circumstances or home care environment. There are 4 key points to remember about PPE use. First, put it on before having any contact with the patient, generally before you enter the patient's room. Once you are wearing PPE, use it carefully to prevent spreading contamination. When you have completed your tasks, remove the PPE carefully and discard it. Then immediately wash your hands before doing anything else. When using personal protective equipment, the order in which you put it on and how you remove it will help determine how effective these barriers are. If you don't use the proper methods, you may inadvertently contaminate yourself and others. It's a bit complicated, so pay close attention. First, wash your hands thoroughly, making sure any ornate rings, watch, and bracelets are removed. If you have long hair, tie it back or secure it so that your hair doesn't touch contaminated surfaces and so you don't need to adjust your hair when you are suited up. First on is the gown. Put your arms through the sleeves with the open part in the back and tie the gown closed. The gown should fully cover your torso, arms to end of wrists, and wrap around the back. Fasten the gown in the back. If the gown is too small to fully cover your torso, use 2 gowns. Put the first gown with the opening in front and the second gown over the first with the opening in the back. Fasten the gown in the back. The next step is the mask. Secure the ties or bands around your head and neck. Then shape the flexible nose piece to the bridge of your nose. Fit the mask snugly to your face and below your chin, adjusting as needed to get a close fit for the most protection. Remember, you don't want to touch the mask during use, so take the few seconds needed to make sure it is secure on your head and fits snugly around your face so there are no gaps. The mask should be changed if it is wet or soiled. If you are wearing an N95 respirator, fit check it. That is, as you breathe in, you should feel the mask collapse slightly. This shows you have a good fit and air is entering through the mask, not through gaps around it. If your healthcare professional has suggested that you wear eye protection, the next step is to put on the goggles or face shield. Place either device over the face and eyes and secure the unattached earpieces or headband to your head. Adjust the device to fit comfortably. Goggles should feel snug, but not tight. The last step is putting on disposable gloves. First, you put on one, and then the other. Ensuring that the top portion of the glove fits tightly over the gown cuff to seal out germs. No forearm or wrist should show. So to put on personal protective equipment, you first wash your hands, then put on the gown, then the mask, then goggles, and then gloves. Safe practices help protect you and limit the spread of contamination. While you are wearing PPE, keep your hands away from your face and don't touch or adjust the equipment. Limit the surfaces you touch. Change gloves when they tear or become heavily contaminated, and wash your hands before putting on new gloves. After taking care of your patient, you must remove the protective equipment in a specified order so that you don't contaminate yourself. Take special care so that you don't touch the contaminated surfaces of your personal protective equipment. Your personal protective equipment should be removed at the patient's doorway or anteroom. Begin with the gloves. The outside surfaces of your gloves are contaminated. Grasp the outside of the glove cuff with the opposite gloved hand and slowly peel the glove off in one fluid motion, inverting it as you go. Be careful not to snap or flick it. Hold the removed glove in the gloved hand. Slide fingers of the ungloved hand under the remaining glove at the wrist. Peel the glove off over the first glove, making sure the first glove stays inside the second glove as you peel it off. Carefully dispose of the contaminated gloves in the trash. Let's watch this procedure again. Grasp the cuff with your fingers and slowly peel the glove off in one fluid motion, inverting it as you go. Be careful not to snap it. Slide the fingers of the ungloved hand under the remaining glove at the wrist, making sure the first glove stays inside the second glove as you peel it off. Carefully dispose of the contaminated gloves. Now the eye protection. Treat the outside of the goggles as if they were contaminated. To remove, handle by the headband or earpieces. Place them in a designated receptacle for cleaning or in a waste container. Remember, goggles or protective glasses can be washed with soap and water and reused. As with your other protection, assume your gown, especially the front and sleeves, are contaminated. Unfasten the gown, pull the gown away from your neck and shoulders, touching only the inside of the gown. Turn the gown inside out as you remove it. Fold or roll the gown into a bundle and discard. Last is the mask. The front of the mask or respirator is contaminated. Do not touch it. Grasp the bottom and then the top ties or elastics and carefully remove the mask. To safely remove the mask, touch only the straps as you carefully untie them and pull the mask away. Dispose of the mask. Be careful not to touch any of the outer surfaces of the personal protective equipment. They may have come into contact with germs. Once you have all the protective equipment off, wash your hands carefully. Remember, the order going on is hand wash, gown, mask, goggles, and then gloves. Taking off is gloves, goggles, gown, and finally respirator or mask, followed by the very important hand wash. It is important to follow the steps and the order outlined. If you do not, you run the risk of exposure to germs and contamination. For more information about the use of personal protective equipment, check out the Centers for Disease Control website. We have reviewed the steps that may help prevent the spread of respiratory illnesses such as flu and actions you may take to keep you and your family healthy. Review these steps with family members, especially children, and model this behavior. To prevent the spread of flu, wash your hands often. Try not to touch your eyes, nose, or mouth. Germs often spread this way. Cover your nose and mouth with a tissue when you cough or sneeze. Throw the tissue away. If you have no tissue available, cough or sneeze into your sleeve or elbow area, not your hand. Wash your hands often with soap and water, especially after you cough or sneeze and before you eat. If you are not near water, use an alcohol-based hand sanitizer. Avoid close contact with people who are sick. Try to keep a distance of at least 3 feet between you and someone who may be ill with a respiratory illness. When you are sick, keep your distance from others to protect them from getting sick too. If you or a family member, especially children, get the flu, stay home from work, school, and social gatherings. In this way, you will help prevent others from catching the illness. If you become sick and must leave your home, do wear a mask to protect others. If you are sick and must travel, Do not travel by plane or any other mode of transportation in which you will be in close proximity to others. Do not prepare food that others will eat. Practice good infection control methods. Practice good methods of home health care. Plan for an emergency event in which you and your family may need to be at home for an extended period of time. Stock and maintain medical and emergency supplies. By using these methods, you and your family will increase your chances of staying healthy and will be able to deal with emergency situations that come your way. If you have any questions regarding the material that has been presented today, contact your healthcare professional. And remember, when it comes to infectious diseases, an ounce of prevention is worth a pound of cure.
Twinkle, twinkle, little star, how I wonder that you are up above the world so high, like a diamond in the sky. Twinkle, twinkle, little star, how I wonder what you are. There, I didn't.
Wash my hands as much I do to keep away pandemic flu. Soap and water wash away germs I touch throughout the day.
Wash my hands, this I must do to keep away pandemic flu.
The only problem was she wasn't washing her hands right.
Wash my hands, this I must do to keep away pandemic flu.
Dirty fingers must not pick nose or mouth, which could make me sick. Wash my hands, this I must do to keep away pandemic flu.
Two.
Do it again.
Achoo.
Sneeze, Mike.
Achoo.
Do it again.
Achoo.